Hello and welcome to this morning's webcast with iTech, where CEO Philip Chabane and Cecilia Olausson, Head of Regulatory Affairs, will address the re-registration of Selektope in the EU. After the speech, there will be a Q&A, so if you have any questions, you can submit them in the form to the right. And with that said, I hand over the word to you.
Thank you so much, and all very welcome to this early morning webcast. The aim is to give a further clarification to the release, the news that was sent out by iTech yesterday at 5 o'clock in the afternoon. It is regarding the re-registration process, as was highlighted by Ludwig here earlier. But before we go into that, I introduce Cecilia Olausson, Head of Regulatory Affairs. Together with myself, we will try to guide you through this and most importantly, be available for questions. Before going into the regulatory aspects of the event that we were confronted with very recently, I just want to highlight that Selektope is, as you all know, a biocide. It is a crucial element in advanced marine coatings to keep hulls clean and hence being a detrimental part of helping the shipping industry achieve its goals in cutting CO2 emissions. A challenge that is enormous, needed, and that requires the collaboration of many different ingredients in a paint, but beyond that, introduction of many different technologies on a ship. All together, these goals can be met. In terms of products in general, they all have to go through different regulation processes. When it comes to biocides in the marine industry, it is a very complex process, and it is normally exposed to being in the forefront of introducing new classification criteria that are yet not introduced to other chemicals. The degree of conservatism is enormous, and therefore the remaining biocides are extremely well understood and have all obtained their approvals on different regulatory markets based on significant data generations since many years back. And as you know, fouling is a challenge, has been for many centuries, and the existence of current products is the stepwise development based on experience through centuries of development work. And Selektope and Medtomadine, which is a generic name, is an element and a member of those technologies that are constituting the solution to cut CO2 emissions on ships. So the process that we're in is a re-registration process within the European Union. It is not a global process, it is a European process. It is in the early stage of this process. We are being assigned, as everybody else, a member state who is taking care of the dossier creation and is supposed to be our interface. Their obligation is to guide us through this different criteria that are to be met. And in certain of those criteria, such as endocrine disruption, which is a novel one, it is common that such instances or institutions take support to discuss data with other member states experts. That is what we call in the press release an expert group meeting, and that was held very recently with regards to Medtomadine and its potential effect as an endocrine disruptor. Having said that, it's a very early stage summary that the expert group made. It's a group which is not allowing for the applicant to be present unless another non-profit organization with health stands by and allows the applicant to take the seat. Yet there is not much room for commenting. So this is a fairly closed meeting. It's confidential, with the one exception of summary note being released following this meeting on the ECHA webpage somewhere. And that is forcing us to be public around this, as it is a public company we're talking about here. And the press release was then sent out yesterday, as there were no further chances to change or amend this publication from ECHA. That may come out in the next 10 days. So it's important to state again that this is a recommendation in an early stage process by a group of experts on this specific topic. It's not legally binding, it's not an official decision, it's a recommendation, and there are then plenty of different steps ahead of us in which we will have various degrees of possibilities to impact and further discuss this data. The data and the process itself, we obviously object against, maybe not the data, but the interpretation and the relevance of it in this specific case. That's an important comment. And there are also a process in which we have our opinions on how things have been interpreted and so on. And in all fairness, we hope that the continued steps of this process, which is likely a few years, will balance out and take into account all these different opinions from our side and our expert sides and other stakeholders. Having said that, it is fair to go into more details of what actually was discussed and our opinions around that. And there's no better person around to help us understand this better than Cecilia Larsson. So I hand over to you.
Yes, thank you. So one of the important criteria when it comes to assessing endocrine disruption is that you need to have an adverse effect in an intact organism or the organism's offspring. Yeah, children, basically. And an adverse effect means that you need to have a change in physiology, in how you grow, in development, in reproduction, in lifespan, or something like that. So it needs to be a really adverse effect. And what we object to in this process is that adversity has not been demonstrated in the studies looked at. So basically, the Norwegian authorities has looked at pharmacological data for Medtomadine that has been generated for the pharmacological approvals of using Medtomadine and dexmedetomidine, which is the most commonly used substance. And has been known for the last 20 years that these effects occur in humans when you use Medtomadine at pharmacological levels. You use Medtomadine to create sedation. And this is the desired pharmacological response. The sedative effect is reversible as soon as you end dosing and the Medtomadine is eliminated from the body. It's a very rapid elimination, so you quickly wake up again or become less tired than you were during dosing of Medtomadine. Medtomadine affects a receptor in the body and creates a lot of different responses besides the sedative effect. And that is common for a lot of pharmaceuticals, as I think most of you know. And these sort of side effects or effects seen in parallel with the sedation is what the authorities are looking at. And there are no adverse effects, no effects on endocrine tissue. And yeah, basically they are also reversed once the exposure is ended. There is no long-term changes to function in any way that could then be considered adverse. And again, that is something we really think it's important to remember. So these are all temporary effects seen during pharmacological exposure of Medtomadine. Another important factor to remember is that the assessment of chemicals or biocides for endocrine disruption does not at all take into consideration how a substance is used. So while you use Medtomadine or Selektope as we sell it as, then of course sedation is a completely unacceptable effect. So when you use Selektope as a biocide, sedation is a toxic effect. And it's irrational to base an assessment of endocrine disruption on doses that cause sedations in humans and compare those pharmacological side effects seen during sedation to the use of Selektope as a biocide. The biocide use is strictly limited regarding exposure. You have significant safety procedures to ensure a large margin of safety for anyone who could be exposed, let's say, who handles Medtomadine or products containing Medtomadine or Selektope in any way. And this should really ensure that those temporary side effects seen at sedative concentrations could never occur in the use of Medtomadine or Selektope as a biocide. Yes, and I think that is slightly into the details. Of course, we will take questions later.
Yeah, so thank you, Cecilia, for that. And that basically encompasses our position on a high level in this process. And again, emphasize that we are in the beginning of a long process, wherefore lots of activities will remain, a lot of discussions, opportunities will remain with the authorities. But I know you are sitting on a lot of questions, so instead of us trying to foresee all your opinions or thoughts, we leave the floor to Ludwig and his team to put forward questions that may have come in.
Thanks. Yes, we have received a couple of questions here. The first one is, if the compound is not approved in the EU, what will the implications be? Will other regions continue to use the paint, and will ships coated with Selektope still be able to dock in the EU, for example?
So in terms of the ships, there are no restrictions for docking in Europe, but if the substance at the end of the day is not approved, they cannot reapply the coating containing that substance. The ship containing that substance, but being then coated with it elsewhere, can enter harbors and trade within European waters without problem, but it cannot be applied or sold within the European Union. But that is in the event that it is finally forbidden and taken off the list. In the first question, does it potentially affect other regulatory regions? We believe that in the short term there is no effect. We hope that in the long term there are a more balanced view in many other regions on how to combine eventual side effects or risk for side effects with the large benefits of helping saving emissions to air in this case, and also helping save environmental aspects in the environment, such as avoiding transport of invasive species. All those really important aspects that a marine coating actually stands for. So I think that the side effects in Asia, it can happen, but we do not foresee that in the short term. I should also mention that there are previous examples of substances in the marine area where questionable discussions have been held within European authorities, as an example, and where we see that Asian markets are continuing on as they were before the announcement of those disturbances in those processes. So all in all, we don't see that risk as large at this point.
Thanks. Will the company use a lobbying agent to address this in front of politicians and regulators going forward?
I can maybe start. We're giving all support we can, by the way, to Cecilia and her team. She's working with the best possible advisors, both on the expert side and on the legal side. In addition to all that, advocacy will be part of the process moving forward, where we hope and look forward to stakeholders raising their support for biocides in general, because it's maybe an existential part of the process for others as well, who knows. But most importantly for us and for the Selektope brand and its need, an essential need actually in paints to make them perform better and optimize them in terms of both emissions, potential to reduce emissions to air, but also help other aspects in the paint, reducing loadings in general. Cecilia, you want to add something to that?
Yeah, we will definitely liaise with other stakeholders in the chemical industry to try to, I think in general, influence where the legislations are moving to ensure that substances are assessed on a reasonable level. Of course, we should not have dangerous substances exposing humans or being released into the environment, but there also has to be some form of realistic perception of what is danger, and is it hazard, is a substance hazardous, or is there actually a risk when it's used? If a substance is hazardous by itself, there might still be a very, very low risk when it's used, for example, in an anti-fouling paint. And those kind of questions are really not taken into consideration at the moment. So that is definitely in our plans.
Thanks. In real terms, does this mean that you cannot sell in the EU if the advisory board's recommendation stands?
If this recommendation stands throughout the years of processing that is ahead of us, then there is a grace period, and if that stands through all different appeals that we can do, it will automatically be delisted from the list of approved substances, and then of course we cannot sell this to customers with the intent to apply it within the European Union. That is correct.
How do you believe it will affect your ongoing customer discussions?
Difficult to say, but this is an industry that is quite used to various bumps in the process. We are by far not the only one who has had some irregularities in these processes back in the days, and even as we speak, we are in a group of others who always have to discuss and confront different opinions by the regulators. I think they are hopefully quite cool about it, knowing that this and understanding the process, and that there's ways to go before this actually materializes into something that's tangible and that actually poses a threat to the existence of the substance in Europe. But bear in mind that all our products, customer products, are intended for use in the Asian area, because there's another issue in Europe which is not related to Medtomadine as such, or nor to other biocides in general. It is that the authorities are having a huge backlog, as we have communicated before, in approving the end product, the anti-fouling product and such, meaning that no novel review of products has been put forward, except maybe one or two exceptions, the last 5 to 10 years, despite many paint makers applying for approvals. So there is a tendency to move outside of Europe anyway when it comes to novel approaches and novel technologies in this field. So I think they're used to this kind of discussions. We are confident that we will gain respect within the discussions with them of what's actually going on, and all the measures we have and all the tools, I should say, that we have available to make this not become an exclusion criteria for us.
If we look back a bit, how often does the ECHA follow the advisors group's recommendations?
Cecilia.
Yeah, that is a bit difficult to say, since these type of discussions are confidential. So we will know what was the recommendations from the expert group will be then published in these summaries. But then we will not know what happens during that process. And since endocrine disruption is quite new criteria, there hasn't been that many assessments. So it is a bit difficult to say.
Yes. If we take an overview, how large part of the business comes today from the European market?
Less than 5%. Having said that, that's deliveries into the European factories of our customers. Then 95% of sales and export is obviously to other countries, and those are outside Europe, as you understand, and into Asia.
Will you be addressing the scientific and legal argument at the same time, or is it type of a two-step rocket, so to speak?
That will be a two-step rocket. So the scientific argumentation is ongoing, I would say, towards the Norwegian authority regarding the document they produced, and that was discussed at the expert group meeting. So that is ongoing as we speak, more or less. The legal procedures is a more long-term process, because you can't really legally object until decisions are made. So of course we will keep a close eye on what's happening at the moment and make sure that everything is done by the book, or follow those things that we don't think are done correctly. But if we in the end want to legally object to a classification, we need to wait until a decision is made. So that is a couple of years ahead of us.
There's a lot of questions here asking about if there's any risk that there is a possibility to change classification in the Asian countries like Korea and Japan, for example.
Did I take that one?
Yeah, you can start.
Yeah, so we have current approvals in China, Japan, and South Korea, which are the major markets, and those are relatively new. So the Japanese authority did a thorough assessment of Medtomadine just a couple of years ago for a renewed approval, and the likelihood of them doing a reassessment based on this opinion is very low, I would say. In Korea, there is new legislation in force, antifouling substances have a grace period until 2029, until the assessment starts there, that they would follow a European recommendation is difficult to predict, but it's not likely that they will do anything at the moment. The Chinese authorities, I don't think that is very likely either, that they will reopen any assessments.
And I think maybe to add to that, all those countries are very relying on the shipping industry and everything that comes with it, right? The ports, the yards, the technologies that are being developed around it. And I think they see a big reason to defend and promote technologies and create an inspiring innovation climate for technologies for shipping, as they want to be the leaders, not only in new building, but also maintenance of ships. So we see a different pattern and a different view of things in general in all those countries.
Yes.
What is the time frame for the final decision of Medtomadine classification to be made by the EU?
Yes, so when it comes to time frames and EU, those are very difficult questions, since the European authorities have a history of significant delays. But the time frame is that sometime during this year, Medtomadine will be discussed in something called a working group at ECHA. The working group comprises of the 27 member states and their representatives from the chemical authorities. And they will then take a position if they agree with the expert group meeting or if they don't agree. That opinion will then be delivered to something called the Biocide Products Committee, that also basically takes an opinion and forms a recommendation that they give to the Commission on how the Commission should label Medtomadine, basically. So The Norwegian authorities hope that this will be finished during summer 2025, but based on experience from other substances, it could be a much, much longer process. We know substances that's been in discussions for at least, 8 years at the moment.
In the previous approval PDF available online, the ECH wrote that the active substance is not considered to have endocrine disrupting properties. Why has that ground point changed?
Well, the assessment of endocrine disruptive properties has changed. I think that is one of the big things. The other thing is that if we look at the draft we received from Norway a year ago, all this pharmacological data was not taken into consideration at all. So this is a very new thing to look at these types of effects. They are not really what the legislation was designed to look for. So it's it feels a bit like the regulatory authorities are testing new ground on how to assess chemicals, and we are the guinea pig.
Do you have any customers in the EU region who are directly affected if this suggestion should be finalized?
No, well, we have customers in EU being such that they are headquartered in EU. As you know, all the customers that we are having the privilege to work with are global, right? They export everything. And as you also know, the majority of everything that's ongoing within shipping is outside of Europe. So they all have a huge footprint outside of Europe. Then, having said that, there are obviously yards in Europe and there are special products sold in Europe. Those are the old products, as no new products has been brought forward by authorities the last 5, 6, 7 years. And they will continue to sell those. In case they have registered products in Europe, which is the case for one paint maker, they will obviously have a challenge to continue to sustain those on the European market if this recommendation at the end of the day, many years ahead, gets excluded from the regulatory list.
We're moving towards the end here, but a last question. In a worst case scenario, are there alternatives currently available to replace Medtomadine with?
Well, let's phrase it like this. The shipping industry has never been in a bigger transition ever when it comes to cutting emissions to air and also helping protect marine ecosystems in the sense of not transporting alien species between oceans or marine ecosystems. The pressure is enormous. The will to invest is very high. And in the light of that, Selektope is absolutely essential to help boost the power of these paints and help to tune them in and optimize them to actually deliver these kind of savings combined with other technologies, combined with other biocides, and all together helping to reduce and take the next step, which is basically to cut emissions from today's level to the target level, which then means somewhere around 250 to 300 million tons of CO2 per year. That will not happen if technologies that are currently approved following 20 years or more of development are taken off the market. Then you have about 25 years ahead of you before you find a replacement. And as all these targets are set for 2030 and 2050, there's no chance that the industry will be able to deliver its emission targets. So we think this has to be put in perspective, and in that sense, it is not possible to replace Selektope in the market.
Thanks. Just a last small question. If any investors have a follow-up question, how can they reach you in the easiest way to ask a question?
First of all, it's a bit hectic days, right? Because of all the good questions that are being put forward to us. We have decided that I am the point of contact when it comes to all investor relations, certainly regarding this specific matter. So my suggestion is to call. I'm being as open as I can, as large part of the day and evenings as I can. So give an email, shoot an email, give me a call or send a text, and I'll try to get back. And I should also say that there's opportunities to interact with us on social media if needed. I think that's it.
Big thanks, Philip and Cecilia, for talking to us today, and thank you all for tuning in, and wish you a pleasant day.
Thank you so much, and thank you everybody for listening in and for your nice questions.